Good evening, everybody, and welcome to the Health and Adult Social Care Overview and Scrutiny Committee, the 25th of July 2022. We are a few members short at the moment, so I expect they'll join later. There's obviously a problem in them getting here. Jill, would you like to read out the housekeeping notice, please?
Thank you, Chair. Please note that this meeting of the Health and Adult Social Care Overview and Scrutiny Committee is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point along Bradley Road, under the flyover, in the surface car park at the front of the building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning the volume down completely on laptops. Thank you.
Thank you, Jill. Do we have any apologies or substitute members for tonight's meeting?
We have received no apologies and therefore no substitute members, Chair.
Thank you. Do any members have any declarations of interest? Councillor Johnson.
Thank you, Chair. I'd like to declare that I'm employed by Universities Hospital Dorset as a staff nurse.
Thank you. Councillor Evans.
Thank you, Chair. Firstly, apologies for being late. I couldn't work out how to get into the building. Declaration of interest. I'm a bank employee of University Hospitals Dorset.
Thank you. Agenda item 4.
As a governor of Dorset Healthcare University NHS Foundation Trust as well. Thank you.
Thank you, Councillor Matthews. Agenda item 4, confirmation of the minutes. Does the committee agree that the minutes of the meeting held on the 23rd of May is an accurate record? Agreed. Thank you. We actually haven't got an action sheet. It seems to have been admitted in error. So if the committee wishes, would you like to have an updated action sheet circulated outside of this meeting? Yes? Okay. If you've got any questions or inquiries on that, could you email it to Democratic Services, please? Okay. Jill, have we got any public issues?
So there are no public questions, statements or petitions for this meeting, Chair.
Thank you. I'm not sure. We were waiting for our Sam Crow to come in online. Has Sam not at the Teams meeting yet? No? No. Okay. We'll come back to Sam. So if we could move on to agenda item 8, integrated urgent service, included NHS 111 and NHS 111 first programme. Can I call upon Emma Wilson, Head of Urgent and Emergency Care, NHS Dorset Integrated Care Board, to provide an update, please? Emma, welcome.
Thank you, Chair. Good evening, everybody. I'm just going to share my screen now, so I hope it works. Bear with me. So if there is any questions, if it could be wait till the end if that's possible, because I can't see any hands going up while I'm presenting. So I will just show this. So I hope you can see the screen. As Chair said, my name is Emma Wilson. I'm the Head of Urgent and Emergency Care at NHS Dorset. So I'm here today to talk about 111 service and 111 first and 111 online. But I just wanted to give you a background of where that fits with the whole urgent and emergency care pathway. So this slide shows the urgent emergency care pathway, We do have our enablers around the outside, like digital workforce communication and engagement, and also health inequalities is encompassed in all of the other sections of the pathway. So even though I'm talking about 111 today, it is only one element of the pathway, and as a system we do work together. Each one of these slices actually all work in harmony together, which we know on some occasions they don't. So we do work together for the UEC pathway, and we report to the UEC board. So first of all, we'll start on what is the Dorset Integrated Urgent Care Service. So this was launched in 2019. The elements include 111 call answering, which is basically the non-clinical health advisors, and they use a pathway called the Pathways License. So from there, that's when they use an algorithm to decide where the person on the end of the telephone needs to go. If they need clinical input, that's when they go to the clinical assessment service. And this is with the clinical support for those health advisors. There's also 111 online. Now, 111 online, I'll go through more detail later, but 111 online is commissioned nationally, not locally. However, if cases do require a clinical input, they come through to our clinical assessment service, which is local. The other elements in the contract for the Integrated Urgent Care Service is primary care out of hours, 8 p.m. until 8 a.m., 7 days a week. Improved access to general practitioners through a blended model, but this is going to be transferred to primary care networks from October. Night nursing, which is 8 p.m. to 8 a.m. Monday to Friday, and 24-hour cover for the weekends and bank holidays. Also prison health, which is just an on-site GP cover, but 9 to 12 on a Saturday and Sunday at the Verne, and 9 to 12 on a Saturday at Guy's Marsh, plus face-to-face medical intervention. Now, this service is led by Dorset Healthcare, but works in partner with the other partners within the system. So University Hospitals Dorset, Dorset County Hospital, and SWAS, even though Southwest Ambulance Trust are not part of the integrated service, they do still work together. So the NHS 111 service is a commissioned service that myself in NHS Dorset leads that commissioning element. However, NHS 111 is a system piece of work that was mandated in July 2020 from NHS England. Now, the principles were brought in due to COVID as well, to ensure that people went to the right place first time and to avoid overcrowding in EDs. I will leave this up for a moment so you can have a look at this. However, there were 4 elements that we did in Dorset. We increased the NHS 111 capacity, ED direct booking, emergency department direct booking, including into urgent treatment centres and minor injury units, primary care direct booking, and same day emergency care. These are supported by 2 functions which run throughout all groups, which are communication engagement and monitoring and evaluation. The system has the responsibility to meet these principles and to report the activity through the urgent care key performance indicators and to the UEC board. So the positive outcomes from NHS 111 first. ED direct booking. This was to prevent overcrowding in EDs, and patients are booked into a slot to arrive through 111. In some cases, these are booked by health advisors. If it's an easy diagnosis that they need straight away ED, then it's directly booked. Or if a clinical opinion is required, patients are clinically assessed and then booked into a slot. So we have found from talking to individuals that they would prefer obviously to wait at home than go in and wait in a crowded place. But when people do get to ED, they are happy to wait there. So we're trying to avoid that overcrowding element. Same day emergency care booking. This is the clinicians can book straight into a speciality. Now, the specialities are increasing month by month of what we now can book into. Very different from UHD to Dorset County Hospital, but we are really working on this element because it can support ambulance handover delays if we can get people directly into see the speciality consultant instead of going to ED first and then going somewhere else. General practice in hours direct booking. This is booked by a health advisor. Now, there's something called dispositions within 111, and that's when somebody phones up, they're given a disposition. It may be a primary care disposition, it may be an ambulance, it may be ED. In our service, we do have a lot of primary care dispositions. So this general practice direct booking is absolutely imperative that we have. As you can see from the graphs below, we are achieving the 70% target for ED direct booking, but we do want to achieve 100% if we possibly can. For general practice direct booking, as you can see, this is quite an early onset. We only started this last year, but we are trying our best to achieve as much as we possibly can for this, because it will be better for the individual if they are directly booked in than having to call back again. And we want to avoid as many touch points as possible for that individual. I'm just going to touch briefly on NHS 111 online. This was launched in 2018 and uses the same triage system as 111 telephony, NHS pathways. Both these elements are managed nationally. In cases where users request a callback, a message is sent to our clinical assessment service, who will then medically assess the patient to see if they require an appointment to be seen face to face, or can be closed with care advice. So self-care, or we can see where the nearest pharmacy is if that's what they require. In February 2022, emergency department outcomes were offered a callback option. The same option was expanded out to our category 3 and 4 outcomes, which is the ones that are less needing anything emergency, which commenced in May 2022. January to May 22, there were 53,761 visits to NHS 111 online by Dorset. Now, we do need to do more work with the national team on this, but it is good now that they can have clinical support if required. Our current performance in NHS 111, there has been a significant increase in calls into NHS 111 services nationally. Obviously, we've had something called COVID, and the demand for the service has gone up so much by 64% since 2019. And has impacted on the ability to meet the NHS 111 call answering and abandonment rate key performance indicators, which I'll go on to in another slide. Following a review of the demand in 2020 and recurrent and non-recurrent funding was agreed to increase the call answering and clinical workforce within the 111 and clinical assessment. And we are just currently revising that exercise due to the amount of demand there is again on the service. So we are doing more modelling for that. Although demand has increased, Dorset 111 services continue to support the urgent and emergency care services and exceed the validation targets for ED and ambulance category 3 and 4 cases. So validation is where a clinician looks in detail at a case to see if the original clinical outcome was correct, NHS Pathways cannot ask every single question because, as I mentioned, it's an algorithm, and that may be necessary to ensure the patient is directed to the right service. So, for current performance in NHS 111, in May 2022, the average speed to answer calls was 107.3 seconds, which is 1.7 minutes. The key performance indicator is 60 seconds. So we are slightly over that, which we are trying our best to actually come down from that. We also have identified that a person will wait on the call for about approximately 4 minutes before they abandon the call. And this is what we don't want to happen. As soon as somebody abandons the call, that doesn't mean their problem has gone away. They'll either go to the place of least resistance, which is the ED, which is what we don't want to happen, or they will they might get more poorly and not bother to phone anybody, and that's what we don't want either. So we are doing our utmost to get that abandonment call down as much as we can. So as I was talking about the ambulance validations, I think this is a really good slide to show that what potentially could be dispatched for ambulance if they didn't have a clinical validation. So only 440 ambulances were dispatched between November 2021 and January 2022. That means there were 6,985 that were regraded. Now they may have gone to ED, or they would have had another service, maybe same day emergency care, primary care. So that shows how important it is to validate the calls that are coming through. Current challenges at the moment. So due to the increased due to demand increasing across the country, there are other providers calling on national contingency. Now, national contingency means that if a service is clinically unsafe, or they are really under pressure, or there's a leak in the building and they can't answer the phones, then the calls go elsewhere in the country. Now, Dorset, this is some really good news. We don't go into national contingency that much at all. So we do take a proportion of the calls out of area. Unfortunately, there are some providers that do go into national contingency a lot. The downfall of that, with Dorset taking proportion of calls, is that it has a knock-on effect to our performance. The percentage of calls depends on each individual situation, but can be up to 100% of calls at one time, divided amongst the rest of the providers that are performing well. When other parts of the system are challenged to provide a service, this also has a significant negative impact on the 111 and clinical assessment service. So, for example, we do know that primary care are very challenged at the moment, so more calls will come into 111. We also know that the rest of the system and the acutes are also very challenged. So the demand will go back through to 111. We have had our fair share of sickness as well within the system due to COVID-19, and this hasn't supported, obviously, the service either, both nationally and locally. Recruitment into clinical roles is a challenge in Dorset. And Dorset Healthcare do their utmost to advertise as much as they can for the clinical assessment service, but we are looking at other ways that we can actually support this service. The system across Dorset at the moment is in system Opal level 4, which is operational pressures escalation level due to the current pressures. And we've been in and out of Opal level 4 for most of April and May for the 111 service, but the whole system is struggling at the moment. So we have regular meetings and we have a chain of command through our operational delivery group, our strategic resilience group, and our exec gold meeting to try to support this as much as we possibly can. Finally, future developments. There's a national mandate has been released requesting that all areas implement a new telephony platform to enable calls to be switched across providers within a regional footprint. This would also allow for any future movement of borders within regional areas and would allow for further collaboration with other regions to share calls. So this work is currently happening at the moment. My team are supporting the out of hospital offer, which is a system offer. The project ambition is to provide high quality joined up primary and community based urgent care services that meets the needs of the population and to contribute to reducing health inequalities. Currently, we do know that majority of our urgent care services finish around about 8 or midnight in the evening, and then the only place to go is ED. So the problem with that is that we're not supporting the behaviour of the public to use different areas and to be seen quicker. So this is what this work is about. It will contribute to the delivery of a sustainable reduction in people attending emergency department with minor illnesses or injuries, but it will not deliver the totality of this improvement on its own. So that's why we work with the rest of the system. And the Urgent and Emergency Care Delivery Plan agreed by the Urgent and Emergency Care Board is now being implemented and reports directly again to the Urgent and Emergency Care Board. Thank you for listening, and I conclude my presentation. Thank you, Chair.
Thank you, Emma. Yes, members, got any questions? Councillor Jones.
Yeah, thank you, Chair. Em mentioned in a report about the recruitment into clinical roles being a particular challenge. I just wondered how many vacant posts there are at the moment, and I guess moving forward, probably most importantly, how we're going to try and address that shortfall in the medium to long term.
Did you want to answer that, Emma?
Yes, thank you, Councillor. Thank you for the question. So at the moment, the recruitment is ongoing. So it's always trying to get as many people in as we can. Now, there is, as I said, there is a shortage. We are using MIU UTC staff, Urgent Treatment Centre and Minor Injury Unit staff to answer the clinical assessment service calls as well. So that's going to be the future work that we are doing to ensure that we have more of a workforce that is more multidisciplinary and actually can work in different areas. I think we're very lucky we have a community service that's actually delivering our 111, because then we can utilise our minor injury units and our urgent treatment centre staff as well. But it is a national issue, and we are trying our utmost to do this because the clinical assessment service is the most important part of this.
Did you want to ask something else?
Yeah, thank you, Chair. Just wondering, obviously, following on from that, things like pay in terms and conditions, are they being looked at for different roles at the moment, and to what degree?
Yes, so thank you, Councillor. So at the moment, we are looking at that to make sure that every part of the system has an equal pay element to, so we're not robbing Peter to pay Paul for different services. So an advanced nurse practitioner would get the same amount, or a general practitioner would get the same amount. It doesn't matter where in the system they are working to do that, because yes, we are all individual organisations, but we need to come together as a system. So that would be, we have our workforce team working on that as well for system to get some equality.
Anybody else got any questions for Emma? Councillor Johnson.
Thank you, Chair. Emma, at the beginning you said something about slots in ED and people going with minor problems, was it? Not quite so serious? Couldn't they be dealt with somewhere else, perhaps?
Yes, so at the moment, thank you, Councillor. At the moment, our emergency departments are for minors and for majors, so they have two different areas which you probably are well aware about at the moment. But that's one of the areas we are looking at the moment. Should minor illnesses and injuries actually go into ED full stop, and could they go possibly somewhere else? Now, as at the moment, because they do see minors, it is better for them to be booked into an appointment to be seen, so that they're not just turning up and waiting, because the majors will always take precedence because they're very poorly individuals. But that is something that we are looking at. In Poole Hospital, they do have their minor illnesses and injuries going through their urgent treatment centre, so they triaging that through already, which seems to be a success, and that also helps with the handover delays as well. But that's one thing that the urgent care offer project will look at moving forward, but I can't say whether that will happen at the moment until we work as a system on that.
Thank you.
Louise Bate from Health Watch, I believe you've got your hand up. Did you want to ask your question?
Thank
or
you,
is it
Chair.
a comment?
It was a question. Thank you. Hi, Emma.
Hi.
I was wondering how you use patient feedback service.
So obviously it's not my service because it's with Dorset Healthcare, but we do have contract review meetings, and we do ask for complaints, serious incidents, and also any information that's come through from friends and family elements and other bits. However, saying that, Louise, we are currently I'm working with a lady called Kirsty Hillier within our team, who is going to contact Health Watch to do some work for our out of hospital project, because one of the things we don't know really well at the moment is why people use our services as they do. So why are they turning up to ED? Why are they not ringing 111, or why are they ringing 111 and then not listening to the advice in some cases and going elsewhere? There's something fundamentally that we might be able to do differently. So we are going to work very closely with Health Watch, if they would allow us to see from a patient perspective, because in this type of work, qualitative data is probably better than the quantitative data to get down to that depth of why people use the services as they do.
Thanks, Emma. That's really interesting. I think that from what we hear from people, often it might be that people have used 111 in the past and not had a very good service, and then it puts them off contacting it again. So yeah, and I can see that the service has improved kind of, in response times, but perhaps people aren't aware of that.
Absolutely. Communication is utmost and key for this as well.
Thank you.
Thank you. Emma, before I come to Councillor Rampton, can I ask, you said in your report there's been an increase in the 111 calls. Now, do you know what the major reason for that may be? Is it that you're almost a victim of your own success because people now know about 111, or is it just they can't get hold of, for example, their GP or something? Do you know what's driving these calls going up to 111?
So currently, I think it's a bit of both, Chair, to be perfectly honest. So we have done a lot of communication. You've probably seen it on the roadside that says ring 111 first before going anywhere else. We also know that primary care is under increased pressure as well, and they may get a busy notice, or they can't get, so then they do go to 111, and that's why. And I think I mentioned it. Apologies if I didn't, a bit nervous, but I did say that we do have a lot of primary care dispositions, and that's why we book them back in, and we just have that direct booking back into primary care, because usually primary care know the their patients better than 111. So it is probably best for them to go back into primary care. But I think, to be perfectly honest, and it's back to that first pathway, each part of the pathway are so pressured at the moment, and that's why the demand is rising throughout.
Thank you. Can I bring in Councillor Rampton now, please?
Yeah, thank you, Chair, and thank you, Emma, for your presentation. That was really, really interesting. I just wanted to tell committee about an experience that I had supporting somebody who needed to ring 111 and had a really quick response, actually. And we went down to the urgent treatment centre at Poole Hospital, and the person was seen quickly, and there was a follow-up. So really, really impressed with the service, I have to say. If I've got a bit of a moan, and I always have a bit of a moan about something, it was to say that the initial reaction, especially with older people, is it's the GP. And this was a Saturday and the GP wasn't open. And the advice on the website was to ring 111. But ringing the pharmacy, the advice was to ring 111. But people are still going through those usual ways of contacting somebody. So although it's promoted widely, I know it is 111 first, it's an ongoing promotion, isn't it? It's embedding that in everybody's understanding, so that they do ring 111. But as I say, the experience that we had was a really positive one. So thank you.
Thank you, Councillor Rampton. I will feed that back to Dorset Healthcare, who obviously provide the service. So thank you for that. Also, I totally agree, ongoing promotion. And also, that's the only way we're going to change behaviour, public behaviour as well, by doing that. Because sometimes people who work in the services also get very confused about where to go. So if we do, then we need to make sure that the public have a very simplified pathway, so they know exactly where to go. Thank you.
Thank you. Are you happy there, Councillor Rampton?
Yes, thank you, Chair.
Betty, you've got your hand up.
Yeah, thank you, Chair. I just wanted to let Emma know that Councillor Rampton shared her positive experience with me. I think it was the weekend after it had happened, and I did feed that back to my peers in Dorset Healthcare, because it's really important to hear the positive experiences as well as those experiences where we could improve upon. Thank you.
Thank you.
Thank you. Committee members, Councillor Evans, you've got a question?
Thank you. Yes, firstly, for transparency, I do work for the Dorset Integrated Urgent Care Service, but I don't work for 111 or NHS 111. However, I was part of some committees where NHS 111 First was discussed and developed. Wonderful to hear all the positive news, but unfortunately on the ground this isn't really what we're seeing, and it just seems to be overwhelming demand that we are so struggling to meet. I was just wondering, we're saying about the need for good communications and telling people that they should be ringing 111 before, as their sort of first port of call. Obviously, if they then don't get an answer, they're giving up and kind of give up with the whole service. It sounds like things are improving, but I think comms needs to go out to say that, because otherwise people are going, well, in 2019, 2020, I tried, couldn't get through for an hour, never doing that again. So that seems to be a real issue. There's also a lot of confusion about what 111 is for. Is it you just really fancied knowing what certain part of the body does? You've just got sort of some random question that you thought, oh, I might like that answering. Or is it because you actually feel you need to see someone today or tomorrow and want to know who the best person is? Thank you.
Thank you, Councillor Evans. I will take on board exactly what you've just said about comms going out, that the service has improved, because we send out the comms to say where people can go, but we never say actually it has improved, or this is the evidence to suggest it's improved. So I will take that on board. Thank you. the other part of your question, we do still have people who ring because they don't know where else to turn, and it's that question of, is it, so the 111 service is an urgent response, so to your urgent need, not for primary care in hours, but it is meant to be for urgent care. However, defining what is urgent and what is an emergency to every individual is very, very different. And so people do phone up for some things that may not require urgent care service, but they think it does because it's urgent. So we just need to make sure that we have the same communication to those individuals of where better their need will be met, whether it is the pharmacy, whether it is counselling, whether they need to go to another service like for mental health services. So we just need to make sure that communication is right. But unfortunately, we all have a different definition of what is urgent and what is an emergency. We also have people that phone up and it is an emergency, and you say, why don't you just go to the emergency department? So those are the things that I think Dorset Healthcare are trying to do as much as they possibly can.
Thank you so much. That's really helpful. If I may just move on to 111 first. We were discussing about patient experiences. Like I said, I was involved in some of the design of the service. Have we looked at if it has actually improved patient experience on the ground, or if it's just become a sort of another admin part for the NHS to give people hoops to jump through?
Thanks, Councillor Evans. We are trying our best to do evaluations of this, and this is part of the urgent care part. We are getting a lot of positive feedback though from individuals that rather go to same day emergency care because they're seen by a consultant they might have seen before, or the speciality, and can be seen quicker. There still are elements that we definitely do need to improve on. I don't want to make it that it's an absolutely positive picture out there. We're forever making improvements to the service, but we are doing more work, as I said, with Health Watch now through the urgent and emergency care project, because through the urgent care offer project, because if we don't listen to individuals, then we won't get it right. I only can talk for my age, where I live, my children, but I can't talk for an older person who has no access to internet or doesn't, or lives in a rural area. So we really do need to talk to people about how we make sure the service is equitable.
Thank you. Councillor Matthews, do you have a question?
Yeah, well, it's a sort of comment really, but thanks for the presentation. I'm just thinking about in terms of improving the communication. Just a first-hand experience recently, the Sunday before last, I spent 6 hours at the ED department with a family member, and it was inundated with holidaymakers just coming straight off the beach. So I'm just wondering how effective the 111 system is for kinds of being used by holidaymakers. Any way we can kind of promote that, because clearly there are a lot of people who literally come off the beach and stuff. And it was the ED department is not very big at Poor Hospital these days, and it was quite an experience, I have to say. But I just wondered if that was something that could be promoted, and maybe we could promote that along the beach. I don't know.
Thank you, Councillor. Just to let you know that actually we have been targeting B&Bs and hotels with stay well cards as well, so people know where to go, because we obviously had a lot of people going in with sunburnt and those areas, those elements. So we try our best to get in touch with as many holiday makers, because obviously we live in a very tourist area, and to support them. Also, though, it goes on, and I used to work in public health, it's about those prevention elements of making sure you have sun cream on, hydration, and those elements as well. And so they all work hand in hand, really, the prevention element and then the treatment part.
Thank you. Diana Butler.
Thank you. I'd like to ask if you get many people phoning 111 when they're really needing 999. Because sometimes symptoms are similar for different illnesses and conditions, and somebody might think, oh, I don't want to bother them, I'll phone 111. Do you get much of that?
I can't tell you the statistics of that. What I can tell you, though, if somebody did do that and they went through to a clinician, they will be directly put through to the ambulance element, or they will be an ambulance will be dispatched for them. They don't have to go and queue again or phone up 999. It will be dispatched if the more discussion they've had with the clinician, then it will be dispatched if it's showing that they do have an emergency. So they don't have to put down the phone and ring up again. It will be through that element, but I can't tell you the statistics or the data. Apologies.
Thank you.
Thank you, Emma. We were asked to note this report, and I think we've done that. And you've answered all our questions, which is brilliant. So I don't think we need any written responses from that. So thank you again, Emma. Thank you for that.
Thank you for listening. Thank you, Chair.
If we can move on to, I don't think we've not got Sam Crow yet, Director of Public Health. Okay, so we'll move on to agenda item 9, which is the BCP carers strategy. And I believe Emma Senior, the commissioning manager, is going to be giving us an update on the strategy.
Hello, yes, I'll just share my presentation with you. So this is an update on the Carer Services Review and Strategy. And firstly, I'd like to play you a 2-minute video, which was created by the We Care campaign, which is a volunteer-led group founded in 2018, which is by carers for carers. And they've given us permission to play their video, and it describes what it's like to be a carer a bit better than I can. One moment. I hope that video highlighted for you all what it's like to be a carer. So for the purposes...
Thank you. Sorry, just need Democratic Services just need to do something technical, I think.
Thanks, Chair. It's just to say that that presentation, for some reason, is not pulling through onto the live stream, although you can see it in the room. I think the previous presentation is still displaying, whether that share screen has not been stopped. But what we can do is we can upload this presentation to the website afterwards if we can't fix it.
Sorry, Emma. Yes, carry on.
Thank you. So for the purposes of our review and strategy, a carer is anyone who looks after a family member, partner or friend who needs help because of their illness, frailty, disability, a mental health problem or an addiction and cannot cope without their support. The care they give is unpaid, but it does include people in receipt of carer's allowance. So according to the 2011 census, there were 39,525 carers in Bournemouth, Christchurch and Poole. And I'm sure when we get the updated census figures that this number will have increased. And currently only 14% of carers in our area have signed up to CRISP, which is our Carers Information Service, with today's figure standing at 5,665. Carers UK produced a report for Carers Week this year, which found that the value of care providers was estimated at 530 million per day during the pandemic and 193 billion a year. There's been a 42% increase in unpaid carers providing significantly more care per week since October 2020. And 4.87 million unpaid carers are worrying about the impact of caring on their physical and mental health. So over the last few months, we've carried out a carer services review. And our carer survey had 742 responses, of which 411 were returned on paper and 331 were completed online. Of the carers who responded, 179 volunteered to be part of focus groups. And in total, 30 focus groups were held with carers virtually and over the phone. 4 home visits took place, along with 1 in-person group meeting. And 10 focus groups were also held with adult social care professionals and external organisations. We presented the findings of the review at an informal briefing to committee members, and you'll also find the full report in Appendix 1. So from the Carer Services Review, we've identified 5 key priorities for the BCP Carers Strategy. These have been shared and discussed with our Pan Dorset Carers Steering Group, with the BCP Carers Reference Group, and the Dorset Carers Partnership Group. We've also received detailed comments from 26 carers so far, and all have been supportive of these priorities. So here are the 5 priorities, and I'm going to go through each one in detail. So the first one is identification, recognition, and involvement. So we want to identify carers as early as possible in their caring journey. In our survey, 40% of carers said they use the internet as the first place to look for advice. So we need to ensure that our carer support service appears first on Google searches. We also need to support carers to self-identify, as a lot of carers don't always see themselves as a carer or relate to the images that they see in the media. We want to recognise a full diversity of carers. Carers can be of any age and can be caring for anyone from a child with learning disabilities to an elderly parent. We also want to reach out to communities that don't always seek support, such as the armed forces and religious groups. We want to recognise the contribution that carers make to society. They save the economy billions of pounds a year and reduce the demand on social care. We also want to involve carers in planning, commissioning decisions and service design to create services for them that have been designed by them. So how are we going to do this? Well, we want to start by rebranding CRISP, because carers have told us that it's not clear what CRISP stands for and that a new name should be simple and do what it says on the tin. An example would be Carer Support BCP. We want the graphics and photos that we produce to represent the diversity of carers. We also want to work with GP and healthcare services. We've already created a leaflet in partnership between the local authorities and healthcare services across Dorset, which tells carers where to go for support. We also want to provide events and activities that suit all different preferences. And we want to increase the number of carer representatives at the BCP Carers Reference Group. We've just held a recruitment campaign for the Pan Dorset Carers Steering Group, which led to 10 new carers joining. So we know there's a lot of people out there that are interested. Our second priority is information and advice. We want to ensure that information and advice is accessible to all carers. It should be in multiple formats to suit the varying needs of carers. And we want to involve carers in the planning and development of information and advice, because only they can tell us what they're looking for and how they want to find it. And we also want to invest in training, both for carers and professionals. So we're going to do this by redesigning the CRISP website. We've already spoken to young carers who reviewed the existing website and told us how it could be improved for them, such as by including short informational videos. We're going to present information in a variety of different ways, using social media, videos, podcasts, and printed material, because this is what carers told us that they wanted. And we're going to co-design those documents with carers. One thing that carers said was important to them in the review was training. So we're working with our learning and development teams to develop some in-house training. And we're also finding what else is out there, because we know there's lots of free training for carers already available. And we want to make sure we can signpost carers to that. The third priority is supporting carers' physical, mental, and emotional well-being. We want to enable carers to take a break from their caring role. Carers have told us it's not just the caring role, but all of the other responsibilities that sit with them, such as cleaning and maintaining the house. They need a break from all of these things. We also want to support carers to look after their own physical and mental health. In a Carers UK report, a high proportion of carers reported worsening physical and mental ill health following the COVID-19 pandemic, so we need to support them with this to enable them to continue in their caring roles. So we want to do that by increasing the direct payment uptake and increasing awareness and developing training. This will allow carers to use direct payments for something that supports their own needs. We want to review our existing carer services to ensure that they meet the diverse range of carers' needs, including our Take a Break service, counselling, befriending and mentoring, and advocacy. We also want to increase options for short breaks and respite. We've got 2 holiday lodges at the moment, but they're oversubscribed, and carers can only go once every 2 years. So we need to look at what other options are out there, such as Carefree. And this is a service that transforms vacant holiday accommodation into breaks for carers. We also want to review the CRISP staffing levels to ensure that they can offer enough support groups and events and activities that can be accessed by all the carers that want to use them. Our fourth priority is a life alongside caring. We want to enable carers to have time for themselves, because one thing that came up quite often in the Carer Services Review was time, and carers just not having enough of it. We also want to enable carers to access education and employment, and support carers to access the activities that they enjoy so they can live fulfilled lives alongside their caring role. So how can we do this? Well, we want to improve access to and the understanding of carers assessments, both for practitioners and carers, because this will enable carers to talk about what support they need to give them that life alongside their caring role. We want to remove barriers to support and make events and support groups more accessible. We also want to improve access to home-based support, including by using direct payments. Currently, our home-based support service only provides free home care support to our framework of home care providers, and there's currently a lack of capacity at the moment, so carers are struggling to access that service. We also want to work with Carers UK and their Employers for Carers programme to enable businesses to have a better understanding of carers and provide better support for them. And finally, the last priority is collaborative working across Dorset. We want to work with partners to ensure equity of service across Dorset and engage with all organisations that support carers to promote, value and recognise carers' services. And we're going to do this by continuing to build on the strengths of the Pan Dorset Carers Steering Group. We're currently reviewing the Pan Dorset Carers Vision and agreeing new objectives to take forward across the whole of Dorset. We're going to continue working closely with Dorset Council and providing joint services such as the Carers Card and Carers Counselling. And we're going to develop the Dorset Carers Partnership Group to be a single point of access to all carers support across Dorset. When it was Carers Week, we were able to produce collectively a document online on the Our Dorset website that shared all of the different events that were happening across the whole of Dorset. And we were also able to convert that into a paper copy for carers that didn't have access to the internet. So we want to continue doing that work. So that brings me on to the recommendations for today. So we ask that the committee supports those 5 key priorities for the BCP Carer strategy, that you consider and scrutinise the contents of our report, and that you consider attendance at a future informal carer strategy engagement session before we take the strategy to Cabinet on the 28th of September. And just as a final slide, I just wanted to share with you the timeline, which shows that our strategy is going to be presented at CMB on the 23rd of August. We'll be coming back to this committee on the 19th of September, and then it will be going to Cabinet on the 28th of September. Thank you.
Thank you. Committee members, anybody got any questions for Emma? Councillor Phillips.
Thank you. Lovely presentation. Very clear. You said at the very beginning of your presentation that there were only 20 something carers that contributed towards your questionnaires. Why is there such a small amount of response? Is it because historically they feel they haven't got an ear, it's not being heard, and you need to take a different approach to bring in more people to go forward?
I think that figure, well, we had 742 carers that responded to our survey. I think the figure of the 20-something figure, that was 26 carers that have given detailed comments on the 5 priorities. So with the priorities, we discussed them at open forums at our carers reference group, the Pan Dorset Carers steering group, and at the Dorset Carers partnership group. That figure of 26 just relates to some more detailed information that carers gave on those particular priorities.
Councillor Jones, do you have a question?
Yes, thank you, Chair. I was just wondering under priority 3, I was really pleased to see about the enablement of carers to take a break from their caring role. I was just wondering how that would actually happen in practice, bearing in mind obviously some are primary carers, but friends or loved ones. How are they physically able to take a break from their caring role? What support mechanisms are in place to physically allow people to do that?
Well, following a carer's assessment, carers are currently entitled to up to 120 hours per year of free home-based support. So that allows them for home carers to come in and support their cared for person while they can take a break. We've currently got a bit of a problem with that at the moment because there's quite a shortage of capacity in the home care provider market. So it's one of the things that we're really going to be looking at to see what other options are out there to enable carers to take those breaks.
Emma, probably the other thing that happens is short breaks. So sometimes, particularly people with a disability, they go for a short break into a care setting, and that gives the breaker a break from their caring role, maybe for a few days or a week, or to take a holiday. So that it's not just the home-based care, but we find that a lot of carers don't want to leave their loved one for a long period of time. So we're trying to have a flexible approach that gives options to people.
Councillor Matthews, did you have a question?
Yeah, thanks, Chair. First, I'd like to clear up a latent interest. I am actually a carer myself, so I've got a little bit of experience of the sort of being a carer and stuff. I think this is great, Emma. I think it's some really, really positive stuff in there. I'll just sort of echo what Phil said in terms of actually as a carer, being away from your caree can be a challenge. So I totally think being flexible is really, really important with that. The video is really powerful because it talks about the sort of economic sort of benefits to us as a society from carers, and the figures involved are absolutely phenomenal. But it's the value added that we get from carers as well, because fundamentally society would cease to function at all if it wasn't for carers. So I'm obviously very passionate about carers right across the spectrum. One of the things I think is really important, though, to kind of, I don't know if it's possible to, and it's not something that we can perhaps do with our looking at the carer sort of situation locally, but it's something that I think if we could influence would be really useful, is that it's raising awareness amongst wider society about what is involved being a carer, because I'm talking in the workplace, in educational settings and stuff, because the video is very powerful. It tells us quite clearly that carers are hidden. But the experience of carers can be very, very subjective, and it's actually sometimes when you're in a situation where you're having to, I don't know, in a work setting, to explain to your line manager that you've had caring responsibilities and stuff, that in itself can be really exhausting. So actually raising awareness on a societal level, and if it's in any way we can be exemplars of that, I think would be a really good way forward. I have to say, in my experience in the workplace, certainly the organisations that I've worked in the last sort of recent years, the experience of carers is much greater, and that people do really factor that in. But those are just the experiences that I've had. I've spoken to lots of people who really sort of suffer in the workplace and those kind of things. So it's raising awareness, I think is really, really powerful. So whether that's something that we could build in terms of training, perhaps we could do it for staff at BCP Council as a start. Actually, this is what it's like being a carer, because I think that's really important. Thank you.
Definitely, and one of the things that we're hoping to be able to do is work with Carers UK, because they've got an Employers for Carers programme, and within that we can provide tools to small and medium businesses across the BCP area to help them understand carers and support their employees. So we're really hoping to be able to do that. And another way is about raising awareness. I mean, we have a carers card, which is a discount card, which local businesses sign up to. So the more local businesses we can go and talk to about carers and get them to acknowledge and recognise them, the better. So we are hoping to really do that and support national campaigns like the We Care campaign, where the video came from as well, to do as much as we can to get that message out there.
Thank you. Betty, did you want to come in here?
Yeah, thank you. And I apologise, my light seems to have gone really funny, so I'm sorry if I've gone really dark with no light. I just wanted to pick up on the point about how we can publicise the whole role of carers a bit more. And I know that if Emma's colleague Tim was here, Tim Branson, who's our head of service for carers in operations, adult care operations, Tim would want me to say that they are really trying to do more around publicising what carers do, and also looking at ways that we can really promote carers and make it by having much more public events, not just on Carers Week or Carers Rights Day, but throughout the whole year. And Tim, with our colleagues such as Emma and others, are looking at doing some further work with Dorset Advocacy and also around other providers within who assist us within operations such as Palmacare and many others, to really promote the work of carers, all types of carers. And I just wanted to pick up on Phil's point around what other types of support we give carers, and respite away from the home is really important for carers who are caring for people at home most of the year, if not all of the year. And it's so important to them that they're able to take a break away from from their home environments, because it's very hard to not care for somebody who you're used to caring for if you're still in that household with them. So we have many carers each week that we are giving breaks to, and sometimes that's done in the way that the cared for person will go into an interim respite bed for a week or 2 weeks at a time, so that the carer can go away on holiday or just have some space, or just do some DIY or whatever it is that helps them be able to kind of switch off from those roles that they undertake throughout the whole year, and they're really critical to them. So I just wanted to kind of add a little bit to that. Thank you.
Thank you, Betty. Councillor Evans?
Thank you. First of all, I just wanted to say thank you so much, Emma. I think this is an amazing piece of work. I think carers have been unrecognised and unvalued for so long, and I'm just really, really pleased of what you've done, what you've come up with, and if we can do all the actions that you've said, I think it's going to make a real, real difference to the lives of, well, over 40,000 residents. So that's absolutely amazing. Thank you. Just to go back to Councillor Jones's question about carers being unable to take a break, I think the respite and holidays are all very important, but as we've said and as we've heard, it can be very difficult to leave your loved one in the care of someone else. So I think the whole day opportunities that we're discussing later on in the agenda is going to be really important from that point of view, because that's giving carers a respite on a much more daily basis rather than just a week, perhaps once a year. So looking forward to that feeding into this as well. The only thing I did want to question, I was just wondering about this ensuring equity of access across Dorset. Obviously, we are BCP, we're not responsible for the rest of the county, and the needs across the county can be incredibly different, the rural areas compared to the sort of urban conurbations. And I'm just a bit worried about there is a danger of getting too big. And it's very difficult to sort of have local knowledge when you're trying to cover such an enormous area. And also, my concern is with Tricuro having already sort of split, which again we're going to hear more about later. If it's really a good thing to be Pan Dorset, or if we should perhaps just concentrate on BCP and our own residents. Thank you.
And just to comment on that, so although we've got the Pan Dorset Carers Steering Group, which has been running for quite a few years now to bring carers together across Dorset, we did decide to have our own separate BCP and Dorset Council strategies, because like you say, there are quite some differences between the urban and rural nature of both areas. But I think it's something that's been quite embedded for quite some time in terms of carers coming together across Dorset and working with NHS Dorset and Dorset Healthcare as well. And we've spent quite a few years building up those relationships. And like just that ICS leaflet, for example, that's something that can go out to all GP surgeries, all local authorities, all libraries, and it's got details on there about going to your GP surgery to tell them that you're a carer, but also it's got the CRISP, our carer service details, plus the carer support details on there for Dorset as well. So I think it's just something that's quite embedded now. I think it would be quite difficult to pull away from that.
Phil, did you want to come in on this?
Thanks, Chair. I think to try and respond to your question, equity of access isn't about having the same services for everyone. It's about how we make sure that people get same access to the assessment and broader support information available for people, rather than saying we'll provide that same service in every part of Dorset and BCP. So that still gives us, we're not suggesting it's one carer's support service for the whole of Dorset. We're saying that we'll respond locally to local need, but under the umbrella of a wider approach that makes sure that people, wherever you come from in Dorset and however you get referred through from, particularly from health services, you know you're going to get a similar response in terms of assessment and identification of your support needs.
Thank you, Phil, for that clarification. To echo Councillor Evans, I think it's a really good report there, very thorough. I mean, obviously, something like carers, every case is different. No one carer has the same sort of situation as the next person. So to get the feedback from those carers, which you look like you're going to be sort of incorporating into the strategy, because they're the ones that know what's going on at the sort of what do they call it, at the when they're mining, you know, sort of thing. Coal face, yes. So we don't do that anymore, do we? Dig for coal. I was very pleased to see that about the training and the planning, because I know that speaking to carers, that is always a worry that they have at the back of their mind. What if I'm ill? What if something happens to me? What if they get worse? Can I cope with that person? and to get that sort of training and planning and that support, I think will relieve some of the anxiety that some of the carers sort of get. So I was very pleased to sort of see that. Have any members got any other questions? Councillor Butler.
Thank you, Chair. Yeah, I just want to pick up on 3 elements in the strategy. Demographics of carers locally. I noticed that the neighbour element is very low, and I feel that a lot of people who are caring for a neighbour probably don't consider themselves a carer, and so they're under the radar. And in fact, it can happen that the neighbour will actually take on too much gradually and become consumed by how on earth do I do all these things and don't know where to go. So that's just one element of people that maybe we need to look at a bit more of how to contact them and keep them in the loop. Another thing is that one of the carers commented that there's so much available locally. We need to use what's already here in facilities, which I think is really important to know what is local, because there are a lot of things that we could use. And the other thing is the skills and training. A lot of carers haven't got the time of commitment to go week after week, month after month. But if training was like a little bite-sized one session that they could just do, you know, that would probably suit a lot more people. So that was just 3 things. Thank you.
Was that just mainly comments, Councillor Butler? Thank you. Anybody else? Can we go to the recommendations then? Does this committee support the 5 key priorities for the BCP carers strategy? Yeah, okay, thank you. And we're also asked, do we want to have another informal carers strategy engagement session before this strategy goes to Cabinet on the 28th of September? A few of us have met online with this.
Yes, no, I was quite content and happy with the presentations today. So as long as you are Chair, the final decision.
Not my decision. Yeah, you're all happy with that sort of, yes, yeah, okay, yeah, no. So I think we're happy with that as it goes towards the Cabinet in September. So thank you very much, Emma, for your presentation there. So
Thank
we'll
you.
be moving on now to agenda item 10, which is the day opportunities strategy. So can I ask Kevin Gillings, the Commissioning Manager, Day Opportunities, to provide an update on this strategy for us, please? Hello, Kevin.
Hello there. Thank you, Chair. Thanks for inviting me today. I'm just going to share screen to provide a presentation. Okay, I hope you can see that okay. So my name is Kevin Gillings. I'm the Commissioner Manager for Day Opportunities and joined BCP Council in March of this year. I'm looking specifically at the Day Opportunities Strategy project, and I think, first of all, it's worth defining what day opportunities are. So day opportunities can mean different things to different people as quite a wide range in term. They can be about learning new skills, taking part in a wide variety of hobbies and interests, accessing the community, supported employment and volunteering opportunities, and developing friendships and support networks, which are incredibly important to people. The term day opportunities is an overarching term used when referring to all potential activities defined above, and is opposed to the terms of other terms such as day services, day centres, day care, which often have an association with the provisions of a building-based day service. Day services, day centres, day care are included in the term day opportunities, but not vice versa for the purposes of clarity. So looking at some key stats about day opportunities for BCP Council, we currently spend in the region of 6.5 million on contracted day services. Of that, Tricuro, who are a local authority trading company, had a budget this year of just in excess of £5 million. In addition, there are approximately 30 independent day opportunity providers that BCP Council commissions services from, to the tune of about £1.3 million. And furthermore, there are other routes of access to day opportunities, such as self-funding, NHS funding, and direct payments. So looking at the strategy and the key themes of the strategy, first and foremost is about co-production. And by this, we mean individuals or groups of people that get together to design and influence the way that services are commissioned, designed, and delivered. To that end, we have set up a large co-production group, and this has involved service users, carers, service user-led organisations, all providers of day opportunities, other local authorities such as Hampshire, Dorset, and Southampton City Council who have been involved, Dorset NHS, children's and young people's services, and counsellors. And it's an extremely important part of delivering this project in terms of consultation with that co-production group who will be leading on this strategy.
Sorry, Kevin, can I just interrupt you very, very briefly?
Certainly.
We've got quite a bit of traffic going past us and we've got the windows open. So if you could just speak up a little bit, that'd be great. Thanks.
Certainly. Okay. Thank you, Chair. So outside of co-production, the other key themes are about being strength-based. And by this, we mean looking at individuals about what they can do rather than what they can't, and building on those personal strengths and interests. We're also looking at the project being asset-based. And by that, I mean looking at all of the community assets that we have, such as the day service buildings, but also other things such as leisure centres, libraries, and seeing how that we can work together to provide services for individuals and in a joined up way. All of this should lead to innovation within our day opportunities provision and looking at new ideas and looking and learning from good practice. This in turn may lead to market development if there are ideas around different ways of doing things, such as with other authorities have very much looked at things called micro providers, which are smaller community-based local providers of day opportunities. And there may be a need to develop the market, as well as developing those existing services that already provide some excellent work for our end users. This all needs to be sustainable and within a budget that is under pressure, but can be delivered and for the future as well. In terms of the governance structure for this project, the co-production group, as mentioned, is at the top of this chart, but feeds in to all the other groups in a sort of circular chart as shown. We have a steering group which has, again, a significant number of members and mainly around our operations managers, including carers representation, our communications teams, transport, catering, communities, our children's and young people's finance, commissioning services are involved in the steering group in order to do the work that needs to be done as directed and agreed with the co-production group. This in turn feeds into a project board group, which meets every 6 weeks and has senior members from our operations, commissioning teams, communities teams, finance teams, and carers teams. This also feeds into the Directors Management Board and Transformation Integration Board for highlight reports that are provided to that board, and in turn into this committee, the Overview and Scrutiny Committee, and the Council in terms of decisions that will need to be made in the future. So the timeline for the project is an 8-stage timeline. First of all, stage 1 was about revising the programme planning, and over the last few months I've been engaged in looking at that planning around the equalities and impact assessment, the project brief, and other documents that are ongoing throughout the life of the project. We've updated those and they will run for this project and be updated as required. We've looked at data and needs analysis of what we currently provide. And we've taken some really good information from our information teams, but we've also gone out to providers in order to get up-to-date information about their services, where people come from to access their services, what capacity they have within those services, and what their current charge rates are as well, to provide the decent data and needs analysis which will support this project. Stage 2B, we've looked at innovations of good practice. There's been a lot of work done in terms of liaising with other local authorities. In total, we've liaised with about 20 authorities, either directly or via online chat or information provided from other authorities who have done similar work. And this has led us to be able to get a good idea of what other authorities have done, what pitfalls they may have faced, and learning from that work. Stage 2C is specifically about Tricuro, our local authority trading company, who currently run 8 day services. 3 of those day services for Westbourne, Wallisdown and Highcliffe Plus did not reopen with the lessening of restrictions for the COVID-19 pandemic. And this was largely down to a operational reason, in order to make sure that staff were redirected to services, but those services would continue to be provided within their larger Connect services at Boscombe, Parkstone and Christchurch Connect. We're engaged with Tricuro very closely to look at these services and to ensure that we engage all stakeholders into the future of those services. This work is has been ongoing, and there is due to be a survey of all the stakeholders attached to those 3 services into next month and September, with a view seeking report provided by the end of November. The main part of our strategy is stage 3, which we are currently working with our co-production group on in terms of finalising an engagement and view-seeking consultation exercise, a survey to go out to a very wide range of users, as well as those people who don't use services but may do in the future, all providers, the staff who are attached to who work in day opportunities, and indeed professionals who also have a vested interest within these services. And particularly, naturally, our carers as well are a very important part of this. So we will be looking at rolling out an engagement and view-seeking exercise near the end of August into September and October, again with a view-seeking report delivered by the end of November. This will then lead into a case for change and give us some options about what people would like to see for the future of their day opportunities. We'll then be looking at gateway approval. And in the latter stages of this project, the very important parts of co-production design and modelling about what is the approved approach for our day opportunities going forward and how we are going to look to deliver that. That will lead obviously to financial modelling and the business case. That will require assurances and approvals. And lastly, there will be a delivery and implementation period, which may last some years in order, depending on what that case for change tells us. So I hope that gives an overview of the project thus far. Thank you very much for listening, and I invite any questions.
Members, do we have any questions? No, no. Okay. Kevin, this seems to be very much a work in progress here, and I think we've been asked if we want to join the day opportunities co-production meetings. I just wonder, could you explain that a little bit more so that the members understand that and see if they'd be like to be part of that?
Certainly, thank you, Chair. Yes, it's really just an open offer. As I say, we're very open to involvement within the project as well. We currently have 4 councillors who have been invited to the co-production group, and they are Councillor Rampton, Councillor Fears, Councillor Kelly and Councillor Butt because of the portfolios that I hold and vested interest within this project. So it is just simply whether people would like to engage with us in that co-production group. We're currently meeting every 2 months, but we had a recent conversation in our meeting last week where we may make that more often because of the nature of the co-production group are steering that, and that they would like to meet more often to have more involvement in this project.
Thank you for that. Yes, I think obviously as we have portfolio holder updates, I'm sure either Councillor Kelly or Councillor Rampton could give us sort of updates from your meetings there, if that's okay with everybody. Yeah, Councillor Butler.
I'd be interested in attending some meetings for that if they're online.
Are they online meetings, Kevin?
Yes, Chair, they are. Yeah, and we can invite Councillor Butler. Thank you for your interest.
Thank you for that. Anybody else got any questions? We've also been asked, as one of our recommendations, to receive an update once the view seeking exercise has been completed and a case for change report has been drafted. I believe you sort of put some dates in your report there and you think it's likely to be. So I would imagine that a report coming to us is likely to be at the end of this year or at our meeting in March, I would imagine. Is that the sort of dateline you're sort of looking at?
Yes, that's correct, Chair. We're hoping to have a report by the end of this year.
Thank you very much for your time there. And I think it's great to have a change of name, actually. So with the day opportunities, I think sometimes if you just say day centres, people can be a little bit put off. So I think that will appeal to a wider selection of the possible users there. Thank you, Kevin.
Thank you. I very much hope so.
Okay, moving on. Portfolio holders update. I can see Councillor Kelly there on the screen, so we'll go to Jane first.
Thank you very much, Chair. I've been messaging with Sam, and I think he might be, if he's not here yet, I think he will be shortly. So he would be able to update better than I on the COVID situation and the drugs partnership. But I will just, what I was going to do is just have a look. Because I haven't got a massive update for you, Chairman, at the moment, because having only just taken on this part of the portfolio again, I'm really pleased to be here and it's lovely to see you all. But I was just going to mention that the hospital admissions are increasing because there's a bit of a surge in COVID cases. I'm sure we all know someone now who has COVID.
Sorry, Councillor Kelly, can you turn your camera on, please?
Oh, wait a minute.
Just speak up a little bit.
Right, yeah. Right, camera's on now, yeah? Okay.
Yes, we can see you now, yes.
Good. I have a lot of trouble with my...
Oh, you've gone again. Sorry, Jane, you've gone again. We can see Karen. Hello, Karen.
Yeah, the reason is because I'm trying to look at some notes which are on a different part of my iPad, because I have a lot of trouble with the signal if I go onto my laptop. So I think what I was saying was that there is a bit of a surge in cases of COVID at the moment, and therefore the hospitals are experiencing some rise in admission numbers. So no, I don't know what I'm going to do because I really want to look at my notes. It's not good. Is Sam on the call yet? Not.
Yeah.
Hi Jane, I'm here.
Hello Sam, thank you.
Sam. Welcome.
And I'm going to leave the call for a minute and try and get back onto my laptop, but Sam could carry on with his updates. That'd be brilliant. Thank you.
Okay, perhaps we could just quickly go across to Councillor Rampton and then we can come in on Sam's presentations that we had at the beginning of our agenda that we can go back to. Councillor Rampton.
Hello, thank you, Chair. Okay, I've got a couple of little snippets really. Kevin mentioned the co-production group, which I attended for the first time last week, and it was great. And our Louise Bate, who's on this call, is part of that group. I would recommend that committee think about dipping into that. You may not want to go to every meeting, but I think it's really worthwhile to hear the views of the people with the lived experience. And what was really clear from that group, and Kevin and I had a chat about it, was that the group were absolutely insistent that this had to be truly co-produced. And we've pledged to do that, and therefore it must be. The timescales are relatively tight to get to the different sort of points in terms of the democratic process. Which is why I think we were discussing having some extra meetings so that there can be real input from that co-production group into the strategy group, which feeds, one feeds into the other. Strategy group will feed into co-production and vice versa. So I would recommend that anyone who's interested does pop in. Chair, the couple of things I was going to update committee on. One was the Proud to Care campaign, which we launched earlier this month, and that's celebrating everybody who works in the sector, those people that go out of their way to improve the lives of others. And we're trying to attract people into the workforce in adult social care. So there's lots of really good videos and clips and really good examples of people who care and people who are cared for. And we can send you a link after this meeting to the campaign if you haven't been able to catch that yet. But I'd thoroughly recommend that you do catch up with those videos. Probably Councillor Kelly, I'm probably stealing her thunder because Councillor Kelly was probably going to talk about the Joint Health and Wellbeing Board development session, which is happening on the 28th, and that's a development session with Dorset. And I'm sure that in future meetings of this committee, Councillor Kelly and Sam will be updating on some of the outcomes from the development session. And I just wanted to mention the recent heatwave. And sorry, my phone keeps pinging. The recent heatwave and the response from not only adult social care, obviously, from our housing team and from St Mungo's, who deliver the service for us. Sweat was triggered, and everybody stepped up and went out with hats, hydrating drinks, sun cream. We got some people indoors who were quite resistant to coming indoors. So that was a really, really good result. And we also created some cool spaces where people could go, didn't necessarily have a service, but they went into a cool space and were able to shelter if they got too hot. So I just want to say just how seamlessly the services across BCP and our partners worked in terms of supporting those people who are more vulnerable and out sleeping on the streets. And it is always an opportunity to re-engage with those people and to say, we can provide accommodation, please come in, please don't sleep rough. So it's unfortunate that it has to be a heat wave or a cold period, but the work goes on all year. It's just that this was stepped up because of the severe weather, and the protocol was then triggered. And I think the last thing I wanted to say was we've got some real challenges coming up in adult social care. Over the next few months. We've got the cost of care, we've got the charging reforms, and we've also got a CQC assurance process. And you will be hearing more about all of those as the months go on. But I just wanted to committee to be aware that there are some huge challenges for everybody in adult social care with those pieces of work coming forward, and they'll need to be really heavily resourced. So I think that's probably all, Chair, unless anybody has any particular questions for me.
Anybody got any questions, Councillor Hampton? No, thank you, Karen. Yeah. Jane, did you find your notes? Did you want to come back in?
I did. I did. Thank you, Chairman. Actually, Karen has said practically everything, so that's brilliant. Thank you, Karen. Just really about the impact of COVID on both the hospital beds situation and also on the workforce, because there are absences everywhere because of that. So unfortunately, the NHS and care organisations are all suffering. We had an announcement a week or so ago that the over 50s and clinically vulnerable will receive a further booster dose in the autumn. So that's something to look out for, and it'll be delivered alongside the flu jab. As soon as we've got more information about how to access that, then we'll let you know, Chairman and the board. And the other things I was going to talk about are the things that I think Sam's going to mention just in a minute. So I think I'll leave it there now. Thank you.
Thank you, Councillor Kelly. Anybody got any questions for Councillor Kelly? Councillor Phillips.
Councillor Kelly, will the doctors be, as they did in the past, getting in touch with the public, or will it be down to us to actually approach our GPs for that booster, the fourth one?
I think we have to wait and see, Susan, until the more information comes out. I would imagine that's be the case, particularly as it's with flu jabs. That's how it usually happens. There's an announcement that you can come and have your flu jab now. Sam might know more, but I think we have to wait for more information, basically. Thank you.
Thank you. So we'll bring in Sam Crowe, Director of Public Health now. Sam, I'm not sure if you've got much more to update us on the COVID.
Just a couple of points, Chair. Good evening, committee, and apologies for joining the meeting late. Just on that last point about the autumn booster, people will be called. It's going to be offered to the over 50s and the clinically vulnerable, but it will probably be co-administered with the flu vaccine. So people will be called when the vaccine's available, and those clinics are starting to be planned in primary care. I think just in terms of the other update on COVID, I haven't got too much to update on, and I know that Councillor Kelly gave you the figures for the hospital admissions. The infection wave at the moment is mainly because of the BA4 and BA5 Omicron variants. I think nationally we're starting to see that level off, but it has been quite a serious wave, certainly almost as big as the BA2 wave that we had about 6 to 8 weeks ago. The most recent ONS infection seroprevalence survey put the estimate of 5.7% of our local population being affected with either BA4 or BA5. So that's about 1 in 17 people. But I think the national epidemiology at the moment is suggesting that it is starting to level off, and I'd expect it to come down in the next few weeks. In terms of the hospital numbers, I don't know if you've had an accurate update, but as of 8 o'clock this morning, I think there's 121 people in hospital beds in the Dorset system who've tested positive for COVID. But the point I'd make in relation to those figures is quite similar to the last few waves. We are seeing lots of people in hospital who are there primarily for other reasons, who are testing positive for COVID. They're not necessarily in hospital because of COVID-19. It's probably about a third of the hospital admissions that are directly because of the severity of the COVID-19 illness that they have. But still lots and lots of people testing positive, and that's affecting workforce as well, as Councillor Kelly said.
Thank you, Sam. Councillor Phillips, you've got a question?
Yes. Sam, can I just touch on monkeypox? I haven't heard anything locally. Are we fairly okay locally?
So we have had a handful of cases of monkeypox, but it is predominantly affecting networks that have stronger links with London and other areas in the southeast. It's an incident that's being managed by the UK Health Security Agency, which are responsible for the health protection response. So the way that we stepped up and responded to COVID-19 was quite different. As a local authority public health team, we sort of stepped over the line because of the national emergency. With something like monkeypox, we have now stepped back from our local response, and UKHSA are very much the lead agency on this. We have been working quite closely to make sure that our sexual health service locally is informed and up to date and able to be working with their networks to make sure that people are as informed as possible of early signs and symptoms for monkeypox, and they're also starting to think about vaccinating the cohorts that are most at risk. But it's not predominantly a local public health team response issue.
Thank you. Councillor Butler.
Thank you, Chair. Yes, Sam, I'm a bit worried about the COVID jabs being given with the flu jabs. I have spoken to quite a few people who've had side effects from the previous jabs, and also a lot of people who are in homes who've been triple jabbed or even extra ones, are now finding that they've got COVID, and also the staff in the homes looking after them have got COVID. So it's a bit worrying, you know, as to, you know, the more you have, is that necessarily the more effective it is?
Quite a few issues in there, and I can probably pick this up outside of committee if it's helpful. I think in general, what we do know is that there have been studies that have looked at administering the COVID-19 vaccines alongside the flu vaccines, and to my knowledge, there haven't been any side effects from administering both of them. They're considered to be safe to be co-administered. I think there is a debate at the moment going on about the current generation of COVID-19 vaccines and whether a strategy of continuing to offer boosters is going to be as effective as waiting for some of the newer generation COVID-19 vaccines. But as of yet, we haven't yet seen any of that next generation of vaccines being licensed. I think it's important to remember that lots of people may think that the COVID-19 vaccine isn't effective because the virus is very, very transmissible. Lots and lots of people are getting it. It's quite common to hear people say, well, I've had 2 or 3 doses and it doesn't seem to stop me from getting COVID-19. The vaccine was evaluated for its efficacy at preventing the development of serious disease, particularly requiring hospital admission. So that's the basis on which the vaccines were judged efficacious. They do, of course, reduce the risk of transmission, but in a high prevalence wave where lots and lots of people are being infected, it's easy to think that they're not effective because there are so many people that are just picking up that infection. But if you look at the hospital data, you can see very, very clearly they are still having a huge impact on reducing that risk of serious disease. And if we didn't have the vaccines in place, then those hospital statistics would look far, far worse. And unfortunately, some of those would also lead to deaths. So just a reminder that it's about the vaccine's ability to prevent serious disease, not necessarily stop the transmission of infection. That's the basis on which they've been evaluated. But if you'd like me to highlight some of the studies offline, I'd be happy to supply those back to committee as an information note. Those are the studies that look at the co-administration of COVID-19 and flu vaccination. It'd be quite easy to dig those out. I'd be happy to do so.
I would like that, thank you.
Yeah, yes, thank you, Sam. Yes, if you can send that to Jill, who can distribute it to us.
No problem,
So,
we'll do.
Okay, so back with you again, Sam. An update about the Combating Drugs Partnership Board.
Yes, thank you very much, Chair. So this is just a verbal update to keep the committee cited on the new Combating Drug Partnerships Board. This is a requirement for all local areas to start to think about the composition of a local board, which will have responsibility for overseeing and making sure that local areas are delivering on the government's drugs strategy. That's From Harm to Hope. It was published in December 2021. And so the board will really be overseeing delivery of the 3 main strategy aims. The 3 aims are to deliver a world-class treatment and recovery service, and that's connected with additional funding that'll be coming into local areas to support an increase in treatment places for people with serious drug misuse issues. The second aim is to break the drug supply chain, so that's an enforcement aim. And then the third aim is to achieve a generational shift in the demand for drugs. So that's much more about interventions to promote prevention and resilience, particularly among children and young people. So tackling those risk factors that can sometimes lead to an increase in the risk of starting to take drugs. So as Director of Public Health, I've been working alongside the Police and Crime Commissioner, the Chief Constable and the Chief Executives of both councils to look at how we set up a Pan Dorset board. We've been having preliminary meetings just to start to review the membership of the board and to prepare for the first meeting. We're aiming to meet early September as a partnership board to review the terms of reference, finalise the membership and then to look at the forward work programme. But the action for local areas over the next week or so is just to finalise and agree the initial membership of the board, to signal back to government the footprint on which the partnership will be based. So that will be the BCP Council residents footprint and the Dorset Council residents footprint, and just to agree and sign off on the senior responsible officer for the partnership, and that will be David Sidwick as Police and Crime Commissioner. So happy to take any questions, but that's where we are with the partnership. I think it's a really interesting approach to getting back to perhaps a bit of a firmer grip than we've had, because obviously the issues behind drug misuse are complex. You know, they are very, very multifactorial. So having a board that brings together so many of our agencies with an interest in trying to reduce the harms right across the board and put treatment alongside enforcement and prevention, I think is a really interesting way of starting to relook at some of the issues that really affect our people and communities. So I'm quite excited by the work. I'm looking forward to it. And we're very fortunate to have this additional funding coming into both treatment systems. It will land in the BCP Council area a year before the Dorset Council area. But to have that injection of funding back into drug treatment services on both sides of Dorset and BCP Council is really, really crucial. So I'm really looking forward to working with the other board members, and I'm sure we'll keep committee updated as we start to make progress.
Thank you, Sam. Any members got any questions? I suppose because it's in such its early stages, there's probably not too many questions to ask about that at the moment. Maybe later on when they've had a few more meetings. Councillor Kelly, did you want to come in on that?
Thank you very much, Chairman. Yeah, I just want to echo what Sam has said and say how excited I am that we've got this opportunity to start looking at the drug misuse problem in perhaps a different way and with a different group of partners together. We've been working on it for so many years now and making some inroads here and there, and some great successes, but then there's always more coming down the line. And this idea of looking at the prevention and resilience is really key, I think, to trying to make a real difference this time. So I'm so pleased that we're able to do this, and look forward to bringing back to the board some updates as we move on and after we've started our first meeting in September time. Thank you.
Yes, thank you for that. So we'll move on to the Tricuro update, which was asked for by one of our members, and Phil Hornsby's been sat here very patiently. So he's going to give us a verbal update on what's happening with Tricuro.
Thank you, Chair. And for those members who perhaps are new to this committee or more recent, they've joined recently, sorry. Tricuro is our local authority training company that handles adult social care provision. Not solely, they're not the only provider, but they're the one that services that used to be within the council were transferred to back in 2015. And Tricuro was set up as a joint venture between the former councils of Dorset, Borough of Poole and Bournemouth Borough Council. And then, so it's 3 equal shareholders, and then became 2 equal shareholders when we went through local government review. Dorset Council made the decision earlier this year that they would like to set up their own care company, and gave notice on the contract with Tricuro that they wish to exit those arrangements that we'd had in place since 2015. And since then, we've been working jointly with them to make sure there's a smooth transition, that the services that belong within the Dorset geography continue in the way that they should, with the staff that are attached to those services will transfer to the new company that Dorset have set up. But more importantly, what it means for BCP Council and the residents of our area is that services will continue as they have always done under Tricuro, on the understanding that we will be innovating and modernising services over time. But when Dorset do exit the arrangements, nothing changes for those residents within BCP Council area that currently receive the services from Tricuro. Tricuro continues as a company. There's more than sufficient funding goes in from BCP Council to sustain services as they are, and also to look at the opportunities to grow and change and develop the company over the coming years. Staff across both parts of Tricuro, both the Dorset area and the BCP area, have been engaged, and those directly affected informed of what is happening. And Dorset have been doing a good job of engaging with them on an individual and a collective basis. The work that we're doing within the council at the moment is to ensure that the company that remains, the Tricuro brand, is that the company arrangements are correct and sufficient for it to move forward. So I'm working closely with legal services and the Section 151 office, the head of finance, chief finance officer, sorry, to make sure that our governance and assurance arrangements are correct and in place post the changes. There's not really any change for us though. In reality, things will continue as they were. The contract arrangements are in place. They will continue. And we've got a very strong relationship with Tricuro. And in fact, the leader and the portfolio holder, Councillor Rampton, and myself are meeting with Tricuro this week to talk about the future vision for Tricuro and the strategic direction on behalf of BCP Council. I think that's probably where we are, Chair, but any questions that I can answer tonight, I'm more than happy to.
Members, have we got any questions? Councillor Butler.
Thank you. It was just really about recruitment of staff, because I think Tricuro have got the same problems as lots of other care providers.
That's correct, Councillor Butler. The challenges for Tricuro are the same as the challenges for a lot of the independent sector, the rest of the care sector, but also health. And that links back to what Councillor Rampton said about the Prouder Care campaign, which Tricuro are part of. So it isn't just an offer for independent providers, it's an offer for Tricuro as well. They're looking at how they can enhance their recruitment offer, being more of a career as opposed to a job. And so that independent of the Prouder Care campaign, they're also looking at things like job fairs and what they can do to encourage recruitment into their services.
Thank you. Has anybody else got any questions? Do we have a basic timeline for this? Do we know when we're going to part ways with Dorset? And are we keeping the name Tricuro, or are we going to be sort of changing that, do you know?
So, Chair, the first part of it, so the indicative timeline is that at the beginning of October, Dorset will, their new company will come into being and services will transfer over. So the end of September, beginning of October. In terms of the name, I think Tricuro for now can still apply. It could be, the original was 3 that care, which was 3 previous authorities. We've got 3 towns across BCP. So we can retain that. If we wanted to rebrand the company in the future, then that's within our gift. I thought initially, though, we want a safe landing so that the people wouldn't think everything was changing around them, and that the continuation of Tricuro delivering their services was a safer way to go for now.
Yes, I mean, it's a name that people have recognised, don't they? So, yeah, so I mean, if we don't have to, there's no reason to sort of change it. So, no. Anybody else got any questions for Phil?
Again, how many people are under the umbrella of Tricuro in total over BCP?
In terms of those cared for or those that work for?
Who are being looked after?
I don't have that number to hand, Councillor, but I can certainly update committee with those numbers.
Just I was interested in how many buildings.
Well, yeah, well, quite a lot. So several residential homes. We talked about the day opportunities review. So there are 9 day centres at the moment, and then there's a reablement service. It's that short-term recovery service for people who for some reason have had some level of crisis in their life and need support to retain or regain their independence. and then there's some other smaller support service elements that go along with that. So
It's bigger
quite,
than I thought, actually.
yeah,
So
yeah.
thank you.
Overall, it's around about £19 million worth of turnover a year, just for the BCP component.
Thank you very much, Phil, for that. So we can move on to the forward plan, if you've got it there in front of you. We have actually done quite a few that are on this that we can sort of take them off, and we need to change. I think it's not the CCG anymore, is it? It's Integrated Care Board. So we just need to change some of that. But I think there was a discussion when we did our agenda setting that we would try and get some dates for some of these that have been on this forward plan for a little while. But I did see where we've got into the dentistry provision that NHS England were announcing they're going to have improved access to dental care under changes, some new reforms to the dental contract. So that's going to be interesting to see how that sort of pans out for people. So perhaps we could keep the dentistry provision on our forward plan, but to have it for much later on to see what happens if these reforms do happen. I don't know what members think about that. Yeah. Okay, has anybody got any questions about the forward plan? I think we've got the supported living service going on to cabinet, so that possibly needs to be put on there as well. Councillor Evans.
Thank you. There's one correction. I saw Karen Tompkins, apologies, is still down as head of democratic services, so that is changing and reallocating. And obviously we need to note that we've got one less meeting now due to the changes to overview and scrutiny. But yes, it would be good to get some dates against the various items coming up.
Just to say, I've been in contact with Jill Taylor, Councillor Jill Taylor from Dorset, about the Southwest Ambulance Service, and we're just waiting for an answer back from, I think it's Sue Seddon. I'm not sure. I think we've lost Betty Butler. Betty, I think you spoke about this, didn't you? Did you want to come in here, Betty?
Yeah, thank you, Chair. Yeah, I dropped Sue Sutton an email, who's our colleague in the ICB, and Sue forwarded that on to the head of the ambulance, and she was looking for some dates. So I was liaising just back around what the dates might be that we had availability on the forward plan. So she will come back to me with regard to confirmation around that.
Thank you, Betty. Has anybody got any questions on the forward plan? We have also got to discuss, or just agree to, the ONS structure has been changed, and we now have 5 meetings a year instead of 6. So we need to agree to the dates for the this committee, and it has been suggested that we still go ahead with the 26th of September, the 28th of November, and we don't have the January meeting, and then we leap to the 6th of March. Now, does the committee agree on these dates? They're all fine with that one. So the 16th of January won't happen. So if you could just take that from your diaries, that'd be great. So if nobody's got anything else, I think we can close this meeting. Thank you all very much. Thank you for the officers that were on the team, and thank you, Phil, for being here in person.